What makes it memorable?
Pathology saved my life.
Is it because?
I was diagnosed with cancer in November of 2006 when my daughter was 5 months old.
From the very beginning, we had the opportunity to create something new and different. So from the ground up, we created an organization that emphasized highest quality, that had a unique governance structure, corporate structure, that emphasized new technologies, information technologies, computer systems, and we decided to put all of our resources in trying to create the best anatomic pathology company in the country.
We focus on every patient, every specimen, every day, and on systems, processes, and care at every level. And we're going to invest in processes, in first-rate pathologists to make sure that every specimen that comes here is treated like it's royalty.
Every single test that we do, every slide, every piece of tissue is not just a thing, not just a widget, not just something that passes through the company, but it actually is a real human being.
They are the reason that we made the investment in this company, in the building, in the laboratory, in hiring the best personnel. We did it because we care about the patients.
Even though pathology has limited patient contact directly, I don't think we ever forget that the biopsies that we're reading belong to individuals and real people. I think it's a personalized medicine approach that we take. We pride ourselves on accurate diagnoses and timely diagnosis and service.
We have barcoding, like FedEx-style barcoding and tracking of our specimen so that we can tell from the moment it's taken at the doctor's office all the way through the Cellnetix system exactly where it is, who's touched it, and where it's going.
So we built zero tolerance for specimen loss into our systems.
It's not so much offering a diagnosis and moving on. It's really about helping a clinician understand the components of the report and understand what the significance of it is. So we strive to tailor each report to make sure that each patient has the optimal amount of information to help them and help the oncologist understand this disease process.
After reading my own report from Cellnetix, I was amazed at the detail and how much information was corroborated just within Cellnetix themselves.
What sets Cellnetix apart is our approach to pathology. We have a subspecialized approach. We believe that patient care can best be served by board-certified or fellowship-trained pathologists looking at specimens of a particular type in a lot of cases.
As a general pathologist, having the expertise of my colleagues here at Cellnetix is invaluable. If I have a question on any kind of tumor, on any pathologic process, I can go to the expert down the hall and get the right answer.
Pathology is relationship driven, and our pathologists are embedded in the local hospitals. They know their surgeons, they know their administrators, their oncologists, and they're basically in regular communication. Because of our size, we have enough resources to invest in PhD molecular biologists and flow cytometrists and other specialty people that can work with our pathologists then to bring those technologies in-house.
Telepathology and digital pathology is really critical to our operations here at Cellnetix. We have 44, 45 pathologists at 13 to 14 locations, and we want to make sure that that subspecialty expertise is available to each one of them at any time. So all of our microscopes have cameras on them, and any pathologist can at any time initiate a two-way conference whereby they can show their microscope view to any other pathologist in the organization and get a second opinion on them in real time. So within seconds they can call up another pathologist and be discussing the slide on their scope. And what that does is it creates a virtual subspecialized expertise pool between all our pathologists wherever they sit.
These are real people, just like family members, whose specimens are going across. And the decisions that our pathologists make are hugely important in determining the treatments and the diagnoses of what's going to happen to those patients. So we may never see them, but our actions are really important for determining good quality patient care and their outcome.
There's a saying that the pathologist is the most important doctor you'll never meet. The lives of people depend on the accuracy and quality of our diagnoses, because healthcare is driven by lab and by pathology. 60 to 70% of healthcare decisions are either driven, made, or influenced by lab.
To receive my pathology report and to know that it was accurate, that there was a plan going forward, and that I would be treated in a world-class center, all came back from my one pathology report from Cellnetix. It completely saved my life. If it hadn't been for the correct pathology and the specialty care that I received, I wouldn't be here today.